All right, do we have everyone from BridgeSpan ready to go?
Yep. Let me just get the documents up.
All right, fantastic. So yeah, please begin by introducing yourself and explaining your rate request.
All right, I'll get my screen shared here and get started. Hi, good morning. Thank you for inviting us to speak today. My name is Dan Bader, and I'm an actuary with BridgeSpan Health Company. I appreciate the opportunity to share details about our 2022 individual ACA compliant rate filing. BridgeSpan's annual rate change is 8.4%, and this is driven by increasing costs of medical care. BridgeSpan solely offers the Oregon state standard plans and therefore does not have any new plans or discontinued plans for 2024. We continually strive to offer members the most value for their premium dollar. And yeah, that is a pretty basic filing for us for 2024. So if you want more information, you can go to BridgeSpan Health to see more information.
Thank you. Division staff will now lead a discussion about the division's review of the filing and preliminary decision.
Hi there, this is Tim Hinkle. I'm the primary reviewer of this filing. I'll let some other folks introduce themselves as well.
Hi, my name is Tasha Sizemore. I am the Life and Health Program Manager for the division.
Hi, this is Kirsten Anderson. I'm the Deputy Administrator for the division. I see that TK is in the meeting. He might be having trouble coming on to introduce himself. TK is the division administrator.
All right, thanks, Kristen. So I'd like to talk a little bit about what we do here when we review some of these rates, and then I'll get to some specifics on the filing itself. But in general, we look at what the carriers submit to us, and they submit to us some data, some methodology and assumptions, and some calculations. In this particular case with BridgeSpan, it's a little bit unique because with their data, it's actually quite a small amount of data in 2022. So one of the things that it's an actuarial requirement is if the data isn't fully credible, you need to kind of supplement that with another set of data. BridgeSpan's part of the larger Cambia group, and so they're able to leverage some of the Regents experience. And so one thing you'll notice is that when you look at the BridgeSpan and the Regents filing, they do start off and look very similar because the starting point is the same. And so let me go ahead and get into a couple specifics here. Part of the assumptions that we considered are the labor disputes, Senate Bill 1529, which is the 3 primary care visits at $5, the COVID adjustments, there's Medicaid and the basic health plan, or Medicaid redetermination and the basic health plan, diabetes, drug utilization, there's risk adjustment and reinsurance, and the cost sharing reductions. And all these kind of interact with each other and kind of play a role together. So with BridgeSpan, the request is an 8.4% rate increase. And, like Dan said, just some minor changes. The range is 7.1% to 8.7%. There were a couple things in the filing that I just like to point out real quickly here is that the trend was 8.4%. And there was an additional about 1% or so worsening of morbidity of the market for Medicaid redetermination. But overall, when reviewing these changes here, we felt fairly comfortable that the Regents had provided a reasonable rate request. It's not inadequate and it's not excessive, and so we're proposing to approve this one as filed. I will add in one extra thing is that we did ask about the diabetes drugs and the increased utilization about it. And they mentioned that on the individual side, especially here on BridgeSpan, it's based on the demographics and the products offered, that there's no additional impact because of that increased utilization. And so with that, we're proposing to approve the rate request as filed. And I guess with that, I'll turn it back over to Ethan.
Thank you, Tim. BridgeSpan, do you have any additional information or comments you'd like to make at this time?
Not at this time, thank you.
The division will consider all information in making final decision on these filings. We'll now take any public testimony. Please unmute and introduce yourself. All right. Doesn't sound like we have anyone signed up to testify. So let me remind anyone listening that today, August 4th, is the last day for public comments. Comments can be submitted through our website, www.oregonhealthrates.org.